All right, and then sort of briefly orient you to the next talks. We've been blessed with the opportunity to have representatives from several disease-specific organizations and other foundations interested in the clinical neurosciences here with us today. And we're giving them each a few minutes to speak and talk about their organizations and their goals regarding potentially patient-oriented research and how they are supporting it. What I would suggest is if it's somebody who's in your disease area, try to meet them after after we've had dinner. This is an opportunity to network. And then after we've had these brief presentations, we're going to move on to the keynote address by Ray Patrick Blake on engaging patients in our clinical trial planning processes. So first, I'd like to introduce Dr. Heather Snyder from the Alzheimer's Association. Dr. Snyder assists with the oversight of the Alzheimer's Association International Research Grant Program, the world's largest nonprofit initiative to advance Alzheimer's research. Since 1982, the association has committed over $340 million to more than 2,300 best-of-field investigators worldwide. In addition to assisting with smooth review of proposals and distribution of awards to successful applicants, Dr. Snyder assumes primary responsibility for the metrics and qualitative assessments to enhance the program's effectiveness and impact, and for communicating program results to a wide range of audiences. After earning an undergraduate degree in biology and religious studies at the University of Virginia, Dr. Snyder moved on to graduate and postgraduate studies in Chicago, completing her PhD at Loyola University Stritch College of Medicine and a postdoctoral fellowship in the neurobiology program at Children's Memorial Research Center of Northwestern University. Please join me in welcoming Dr. Heather Snyder.
Thanks so much, and thanks to the organizers for having me here this evening from the Alzheimer's Association. The Alzheimer's Association is a science-based patient advocacy organization, so in addition to funding research and engaging in a number of other scientific opportunities, which I'll touch on briefly, we also have chapter organizations all throughout the United States that actually are direct liaisons with families that are living with Alzheimer's disease, including support groups, educational programs, and a number of other programming for families that are facing Alzheimer's disease and related dementia. So it's not just specific to Alzheimer's disease. Our science-based activities, including funding, which you heard a little bit about. In addition, we actually also host the largest conference on dementia science in the world, and that's the Alzheimer's Association International Conference, which will be held next week if anyone happens to be in DC and wants to swing by. Over 5,000 scientists gather for the largest convening looking at the latest in Alzheimer's and related dementia research. There's a number of different ways that we're engaged in clinical trials and in patient-centered research. In thinking about clinical research or clinical trials and clinical research, the Alzheimer's Association convenes a group called Alzheimer's Association Research Roundtable, which actually brings together a number of different stakeholders in clinical trials that look at overcoming barriers for advancing Alzheimer's and related dementia research. In fact, one of the big outcomes from this group was in 2009, one of the meetings was on classification of Alzheimer's. So looking at how we actually define Alzheimer's disease. As a result of that meeting, the National Institute on Aging with the Alzheimer's Association actually convened work groups looking at the current state of evidence for Alzheimer's disease. That resulted in 2011 with the publication of revised guidelines for how we diagnose Alzheimer's disease. Looking at Alzheimer's disease as a continuum, and that what we've traditionally called Alzheimer's disease is the later stages of the disease, and that there is a mild cognitive impairment due to Alzheimer's disease, and actually potentially this earlier window of time where we could identify the underlying biological changes in an individual and diagnose them at that point in time, or intervene at that point in time to stop or slow the progression of the disease. Very much like what we do with cardiovascular disease today. And in fact, a number of different clinical studies are ongoing in the United States and around the world that are doing just that, looking to identify underlying biological changes and intervening at that earliest time point. There are still a number of studies that are looking at those later stages as well of the disease. The Alzheimer's Association has some direct funding for clinical trials, and in fact, we have a program called Part the Cloud that funds phase 1 and phase 2A proof of concept trials for Alzheimer's disease and related dementia, as well as qualification of biomarkers. There are a number of other initiatives and efforts that we're engaged in, which I obviously don't have time to mention today. I'd be happy to answer any questions or talk with anyone throughout dinner or afterwards. And then if you actually have more specific questions, I'm going to call somebody up. But Josh Groh would be happy to talk to you about some of what's going on, particularly in preclinical, some of the preclinical trials that are happening now and some of the challenges that the community is facing with that. So thank you very much and enjoy the rest of your dinner.
All right, next it's my pleasure to formally introduce Chris Fridgen from the American Academy of Neurology. She is the Senior Director, Center for Education, Science, and Conferences. She's been with the AAN for 25 years, and her scope of responsibilities include the AAN annual meeting, regional conferences, research program, and the AAN relationship with industry. So join me in welcoming Chris.
Thank you. On behalf of the Academy, we are just thrilled to be a part of this program. As a person who's worked with the Science Committee for the past 20 years, this has always been a program where we've talked about it and said, how can we get involved? So when the opportunity a couple of years through Dr. Gottman came that we could be involved, we were thrilled to take advantage of that. One of the exciting things about the Academy of Neurology, a 28,000 plus member association of neurologists and others, is that we've just embarked on a new commitment to the neurosciences. We've always been known for our annual meeting and our education and science, but really we're looking at allocating a fair amount of resources in the next few years to enhancing our research program. We currently have a clinical research training fellowship program that's been in place for 20 years, but it's really been in the past 5 years that we've really established a strong program with great results. And now we're looking at what is the next step for our program. Do we do more research at the area we're at? Do we look at bridging grants? How are we going to move forward? And so this is a really exciting time for us. We're thrilled to be a part of this program. Thank you for allowing us to be a part of it. It's a wonderful opportunity to meet the other disease associations that are here because we partner with several of you on our fellowships. And again, all of us working together provide the opportunities to continue the research. So thank you.
So next, I'm going to introduce our representative from the American Association of Neuromuscular and Electrodiagnostic Medicine. But first, I just want to give a specific recognition of the AANEM in terms of their support potentially for participants in this course. They're extremely interested in finding meritorious projects, possibly that are developed as part of this course in the neuromuscular space, to potentially be part of their research portfolio. So I think you definitely want to keep them in mind, and if you have the opportunity, if you're doing research in that space, to meet Dr. Anthony Chiodo, who is a professor in physical medicine and rehabilitation and co-director for the University of Michigan Spinal Cord Injury Medicine Clinic. He's been clinical director of the Spinal Cord Injury Medicine Center at the university since 2002. He's worked on numerous spinal cord injury research projects, wellness in SCI, predictors of health and quality of life in persons with ventilator assistance after SCI. He's published several manuscripts on pain management, wellness in SCI, and is preparing several manuscripts on ventilator weaning after SCI. He has served as a co-investigator for 2 clinical trials of famprodine's efficacy after SCI as treatments for spasticity and for restrictive lung disease. Dr. Chiodo is the primary attending physician for the SCI services in the University of Michigan Health System Adult Rehabilitation Unit, coordinating all clinical services. Dr. Chiodo represents the American Association of Neuromuscular and Electrodiagnostic Medicine, where he serves as treasurer and sits on the AANEM Foundation Board of Directors.
Thank you very much. Thank you for the opportunity to meet with you today. And I have to say, I also want to thank my colleague, Dr. Zachary Simmons, who has been the AANEM contact for this clinical trials methodology course. He was unable to be here and asked me to be here instead. I'm here to say a few words about our interest in and willingness to participate in this collaboration and funding effort, and to highlight our commitment to being the neuromuscular organization that supports and fosters this kind of research. First, a little bit about our organization. The AANEM is a nonprofit membership association dedicated to the advancement of neuromuscular, musculoskeletal, and electrodiagnostic medicine. It was founded in 1953, currently with 4,500 members, and the executive office is located in Rochester, Minnesota. Our members predominantly neurologists and physical medicine rehabilitation physicians who are joined by allied health professionals and PhD researchers working to improve the quality of medical care to patients who have various muscle and nerve diseases. Our mission is to improve the quality of care for those patients through our efforts. Our main focus areas include our annual meeting, which we do on our own, but also sometimes we do in collaboration with other national and international neuromuscular organizations. We have other educational activities, including our collaboration with the Journal of Muscle and Nerve, which we have been related to since 1982. We set professional standards through our relationship with the American Board of Electrodiagnostic Medicine and through our laboratory accreditation process for EMG laboratories across the United States. We're actively involved in advocacy for patients with neuromuscular disorders. We have an active commitment to work with organizations around the United States on Capitol Hill with lobbying on their behalf. We have strong membership organization process, and also we're committed to research through our foundation. Our foundation was established in 1995 to advance research and science related to muscle and nerve disorders. Since its inception, it has helped fund numerous studies and research awards, of which we have many that we do on our own, but we also have multiple national partners who do research grants or proposals with. One thing about our foundation is it's completely funded by the AANEM, so any monies that are given to the foundation, 100% of those monies then go to funding research. There are no administrative costs attached to them because our organization completely funds the foundation. For this specific meeting, our organization is committed a research award of $50,000 per year for 2 years for neuromuscular projects for pilot grant funding. Our hope is that this will be a collaborative beginning that will be able to enhance this, both in terms of the number of grants that we can make available and also the amount of funding we can make available in the future. Again, thank you for the invitation.
Our next speaker is representing the American Heart Association. This is Dr. Julie Lumeng, who is Associate Professor of Pediatrics and Public Health at the University of Michigan. She directs an NIH-funded research program on childhood obesity, and she's been the recipient of one of the inaugural AHA Fellow to Faculty Transition Awards, 2 AHA Midwest Affiliate Grants in Aid, and an AHA Established Investigator Award. She's served on several AHA Scientific Grant Review Committees, on the AHA Midwest Affiliate Research Committee, as well as on the AHA National Research Portfolio Task Force. Please join me in welcoming Julie Lumeng.
So, as he said, I'm not an insider at the AHA, but I've received a lot of funding from them, so sometimes they ask me to do this. And so I'm more than happy to do it. So if anyone has questions afterwards about the AHA and their funding program, I'm happy to talk to you about what my experience has been with it. I'm just going to go through some slides about what the opportunities are for funding from the AHA. I suspect for this audience, it's either stroke or neurological effects post-MI would be the areas that the AHA is probably most interested in, but they have a voluminous website. So briefly, they support research broadly related to cardiovascular function, disease, and stroke, including basic clinical population science, bioengineering, biotechnology, and public health. And I just wanted to put a plug in that when I sat on the National Portfolio Task Force, they spent so much time on those conference calls struggling with how to get more clinical researchers to apply for AHA funding. And I'm a clinical researcher, and I just kind of chuckled through the calls, and I thought I could definitely tell some people about these funding opportunities. They're basically, it's broken down in 2 ways: the National Research Program and the 7 affiliate research programs. Depending on where you are from, here in Michigan, we're in the Midwest affiliate, and they each have slight differences in their funding programs. But again, there's a voluminous website that you can look at. What I'm going to do is fly through pretty quickly what the funding opportunities are in broad strokes to give you a sense. They give out $150 million a year in funding to different research grants. And so briefly, I'm starting with the most junior, and then I'll move up to the most senior. So there's an undergraduate research fellowship program. It's $4,000 if you needed funding for a student in your lab. Pre-doctoral fellowship for graduate students, $200, I think that is, or it's obviously missing a 0. The postdoctoral fellowship provides funding for postdocs. It's essentially the same thing as an F-32. And so what I typically tell people is that if your postdoc is preparing an F32 application, just hand submit it and submit it to AHA for their postdoc mechanism, because it's essentially the same application, you just change the font and the margins. And I've definitely had the experience of things getting funded by AHA, but not NIH or vice versa. The Fellow to Faculty Transition Award is specific to MDs. I don't think anyone in this room is a fellow right now, but if you have fellows who work on your team, when they're a second-year fellow, if they apply for this, it basically provides them the equivalent of a pay award that they can get in their third year of fellowship training, and then they can take that with them wherever in the country they want to start their faculty position. So that's a pretty amazing mechanism. And there's nothing like that at NIH. The Mentored Clinical and Population Research Program is $150,000 over 2 years. This used to not be mentored, and then they changed it to be mentored. The idea is to encourage early career investigators to do high-quality introductory and pilot clinical or population studies. The Scientist Development Grant helps beginning scientists. It's about $200,000 over 3 or 4 years. Beginning grant and aid, $140,000 over 2 years. It's similar to an R03 or an R21. The Innovative Research Grant is very highly competitive. I will show you the funding rates for these in a moment. $75,000 per year over 2 years. And then the Established Investigative Programs, there's a grant and aid, which is $143,000 over 2 or 3 years. It's essentially quite similar to an R03 or R21. So again, for that mechanism, if I submit an R03 or R21 to NIH, I usually just hand submit it to this mechanism as well, in hopes that one or the other will be funded. The Established Investigator Award is $500,000 that is very broad. It's sort of an award to the investigator to use in a broad way to do innovative work and expand your thinking to things you might not do otherwise. The Collaborative Science Award, that's also very highly competitive. People coming from different fields coming together around one research problem, $250,000 per year for 3 years. There's a mentor mentee award, $20,000 per year to facilitate mentoring. And then there are some unique programs, which I won't spend much time going through, but there are multi-million-dollar strategically focused research networks. There's a merit award that they're just going to be starting this coming, the application is going to be due in September for letters of intent. And then some genomics related awards, which I won't go into. And then these are the success rates. I know this is rather daunting. If you look at the far right-hand column, my suggestion, though, and a way to think about this, the success rates are similar to NIH. Sitting on NIH on the study sections for AHA, they feel very similar to NIH. But you know how study sections are somewhat unpredictable. And so this is why I think there's value to submitting it to both mechanisms, and it may hit at one. And they have gotten more competitive in the last 5 years or so, I would say. So I'm not going to go through these in detail. This was just a bit more detail on the Mentored Clinical and Population Research Program and some of the ones that people in this room might be most interested in. But it's all on their website if you wanted to look at it at your leisure. Their application deadlines for all these programs are in July and January, though it varies a bit when each program comes up at either deadline. So I think that's it. I think I will pause with that. Do you want me to take questions or no? No questions?
Well, I mean, no, actually, if there's any questions, sure.
That made it easy. There are no questions.
Next, I am delighted to be introducing Dr. Vanessa Arnedo from the Michael J. Fox Foundation for Parkinson's Research. She is the Senior Associate Director of Research Partnerships at the Michael J. Fox Foundation for Parkinson's Research, the largest nonprofit funder of recruitment and retention strategy of Parkinson's disease research. In this role, Vanessa is responsible for the development of recruitment and retention strategies for the Foundation's observational cohort studies portfolio, including the Parkinson's Progression Markers Initiative, a landmark clinical biomarker study. Prior to joining the Michael J. Fox Foundation, she served as project manager for the NeuroNext and NET clinical trial networks at the State University of New York at Downstate Medical Center, where she managed recruitment and clinical trial operations for several multi-center studies. Vanessa holds an MPH in epidemiology from the Mailman School of Public Health of Columbia University and a BA from the New York University College of Arts and Sciences. Please welcome Vanessa Arnedo.
Thank you so much, and thank you to NINDS and the course directors for inviting me to here today. So I'm going to keep this pretty brief. I do have a few slides, but as has been mentioned, please, if this is an area of interest to you, please find me afterwards, and we can talk about the Fox Foundation and our funding opportunities in more detail. So the Fox Foundation is the world's largest nonprofit funder of Parkinson's disease research. And our mission is pretty specific. We are focused on accelerating the development of better therapeutics for people living with Parkinson's disease today. So since the foundation was founded by the actor Michael J. Fox in the year 2000, we have funded over $450 million in Parkinson's disease research. 67 million, over 67 million last year alone. And we currently have 450 active grants in our portfolio that we manage at the foundation. So our business model is efficiency, urgency, and accountability. So the Fox Foundation does not have an endowment. So basically what that means is every year we are raising funds from donors in the Parkinson's disease community at large, and we are pushing that money out the door every year. So we start back at zero come January the following year. That means that we are very quickly trying to get contracts and grants out at a very rapid rate. So those funds are deployed immediately, and we are constantly in contact with our awardees. We hold people to pretty strict milestones and deliverables, and based on that, we'll sort of feed that progress back to our external scientific advisors. So we also have 10 PhDs in-house, as well as 2 MDs and a team of business strategists to complement them. We sort of decide if we need to sort of course correct and change our strategy based on that. And so actually 89 cents of every dollar is spent on research that we get from our donors every year. So our funding process, I've sort of alluded to that we are constantly interacting with industry, biotechs, as well as our external scientific advisory board and our in-house scientists as well, to make sure that we are apprised of what's going on in Parkinson's disease research and how we can best invest our money to accelerate the drug development pipeline. So we do fund research at all stages of the clinical development pipeline. We currently have 450 active grants, and we sort of take those lessons learned and best practices, and our funding programs tend to change from year to year based on the feedback that we're getting externally, as well as from our awardees. So just quickly to highlight our core funding programs, you'll see for anyone that is interested, the pre-proposal deadlines are coming up on October 28th. For the most part, the way that we approach our funding programs is we set aside a certain amount of money. So there are no actual budgets for a lot of these programs. We sort of like to see the proposals and weigh if they sort of fit in with our priorities and make the decision that way. The only exception would be some of our target validation programs. A lot of those grants are set at $100,000 for 1 year and $200,000 for as an additional year. So I also wanted to touch on some additional resources that I think would be of interest to a lot of people in this room. We also have quite a bit of data and biospecimens that we make available to the broader research community. So we have data that is available, that is open access, that is available in almost near real time for some of these studies in various cohorts at different stages of Parkinson's disease that are available, of course, at no cost to anyone that is interested in using that data. Likewise with some of the biospecimens that we're collecting from particularly some of our observational cohort studies. Those, of course, there is an application process, but very often that is those are open access as well if the rationale is there to send the samples out. I also wanted to call out Fox Trial Finder. This is basically Match.com for Parkinson's disease clinical trials. So it's a way to match people who either have Parkinson's or do not have Parkinson's that are interested in Parkinson's disease research with the researchers that are actually doing clinical trials and trying to bridge that gap. We did a survey and found out that 60% of people with Parkinson's disease are absolutely interested in getting involved in clinical trials, but only 10% do. So this is really the Fox Foundation's way to try to bridge that gap and make sure that people are participating in the trials that you all are setting up. Additionally, and this is not just necessarily for awardees, but as I mentioned, we do have in-house scientists as well as individuals who have been working on clinical trials for many years. We have quite a few recruitment and retention specialists in-house as well that are always available to people, particularly to our awardees, but also to anyone that is just interested to access that expertise. So I encourage anyone who is interested in that to just let me know, and I'd be happy to introduce any of you to our in-house team. So there's my email, and please come and talk to me after, and thank you so much.